Today's program is importance of family history in hypertension. Family history is important in any lifestyle disorder, and hypertension is just one of them, and is very important item also. In hypertension, how family history is important and how it is linked. There are linkage of family history in hypertension in two ways broadly. One is genetic, another is environmental. And genetic, if there is more three or more than three close family members developed or earlier had hypertension below the age of 60, we call it genetic influence on developing hypertension is the in this unit patient. So we'll have to have for genetic factors, we'll have to have close blood relation like father, mother, sister, or brother. So must be having hypertension, developed hypertension below age of 60 years. And if there is three or more than three family member, we call it a very strong family history like this. And how family history is linked with hypertension. That linkage is broadly in two ways. One is most important is genetic factor. That's because the close family members do share more similar genes, more than one similar genes in close family members. So if 1% or 2% or three or more are having hypertension, the same three, four, or more than three, four genes are there in other relatives also, in the family also. So they are having higher risk in developing hypertension. But it is never can be said that if a family member is hypertensive, then the other member will develop hypertension. He or she has got more risk for developing hypertension, but not actually hypertension. Okay, and what are the other risk factors in together with hypertension or other than hypertension in lifestyle disorder, genetic risk develop in ischemic heart disease or any other heart disease or overweight or more fat in the blood like dyslipidemia, or there may be salt sensitiveness in the other members. And other factors, environmental factors, lifestyle factors like habit of smoking, habit of taking unhealthy foods, like most of the fast foods, etc., and not having ideal food, and increasing weight, lack of exercise, smoking, alcohol, all these things comes in the habit. And if the senior family members are having all these characteristics or lifestyle disorders like in them, then there is every chance that the junior members will also develop this sort of lifestyle. So he will be more at a risk for developing hypertension. Not only hypertension, the other effects of hypertension also like stroke or heart disease or kidney disease like this. And obesity. Obesity is an epidemic all over the world now. So obesity is itself is harboring all other diseases, lifestyle diseases like diabetes, hypertension, dyslipidemia, all these things. So in that way, family history is very important for family history is one of the important factors in developing hypertension, particularly in younger ages, that is less than 60 years of age. I think that is almost have covered the importance of family history in hypertension. And now on, if there is any question or anything like that, then I can answer. In developing hypertension, one important factor in the Southeast Asian region or this particularly major important country in Southeast Asian is India itself. We are developing all these sorts of lifestyle disorders more at younger ages. That's a very difficult problem for Indians, and that may be more due to genetic effect. less than 40 years of age having heart attack, less than 40 years of age having hypertension. These are more common in Indians than other several countries like Western countries.